Hi, my name is Allison Cornelius. I'm a USA nursing student and I'll be performing the Suds Enema checkoff for you today. So here's my ID and scan the room. So the first thing I'm going to do is verify my order and verify hospital policy, and I perform hand hygiene. And then I identify my patient. I have two identifiers. So I have Mr. Jaguar, or I have patient Jaguar J. Jones, date of birth 8/25/1963, MR number 4176352. And I see the allergies are penicillin, and I see that also on the armband. And I asked my patient if they had any other allergies I needed to know about. Then I explain the procedure to my patient, and I provide privacy, and I gather all my equipment. So I would normally have an IV pole, but I do not have that today. And then I have a picture of a bedpan. So I perform hand hygiene and put on my goggles. And I want to state that I'm working below the waist level. In a regular hospital setting, I'll be working above the waist level. So I'm going to grab my Enema bag, and I'm making sure the end is clamped. Then I will grab the water, and I'm going to pour 750 to 1,000 milliliters of warm water into the Enema bag. And this is an adult size Enema bag. Okay. So now I'm going to add my soap. Okay. So I'm going to agitate the bag to make sure the soap is mixed well. I'm going to set on a firm surface. Then I will put on my clean gloves. And I'm going to prime the tubing. Okay. I'm going to reclamp. Then I'm going to raise the bed and lower the side rails and make sure my patient is in left lateral Sims position. Then I'm going to grab the tubing with my dominant hand and lubricate with my non-dominant hand. So I'm going to lubricate. Then I'm going to tell my patient to, I'm going to grab their hip gently but firmly and tell them to take deep breaths during the procedure. Then I'm going to spread their buttocks with my non-dominant hand and enter 3 to 4 inches. If my patient had hemorrhoids, I would tell them to bear down during this part. Now that I have it there, I'm going to unclamp and hold it 12 to 18 inches up. So I'm going to let that release. And then if my patient was feeling uncomfortable or having cramps, then I would lower the bag and tell them to take deep breaths. So I would let that completely empty. Then I would remove and discard. Then I'm going to encourage my patient to hold the enema for 10 to 15 minutes. And then once they're ready to evacuate, I'm going to take the bedpan and have their buttocks be on this part and have their thighs on this part. Have it face that way so it would be this way and have them evacuate. After they evacuated, I would help them clean up and get them in a comfortable position. Lower the bed and raise the side rails. Then I would take off my clean gloves. Glove to glove, skin to skin, perform hand hygiene. Then I would document the type and amount of enema, the time the procedure took place, and how the patient tolerated the procedure. Then I would document the color and type of, the color and amount of return. Then I would document the, how I left the patient after the procedure. And that's it.